Hi, friends. Welcome to today's episode of We Are Marketing Happy. Today, I am super excited to have Sal Braico on. He is the CEO and co founder of Pivotal Health, which is a company located in Wisconsin. They're in three metro regions right now, and they're really changing the way that consumers have the ability to access health. So, Sal, I'd love to start off with you just telling us a little bit about your organization, the timeline, when it started, and what you're doing to be able to provide patients this improved access to care.
Yeah, Jenny, thank you so much for having me on. So, I've been in healthcare for about 20 years now. I've started, run, scaled multiple healthcare companies. So I've seen healthcare from many different angles. And over the years, I've just become more frustrated myself with having to try to navigate it. Even as someone that understands how health insurance works and kind of what's going on in a provider organization, it's still difficult for someone like me to even make appointments and get prescriptions filled and to try to get help for my family. It's not easy, and it seems like it's almost purposely designed to be confusing. And that's not the case, but that's what it seems like. And again, that's coming from someone who really understands healthcare. So someone who doesn't really understand healthcare, someone who hasn't been in this industry for so long, I mean, I can't imagine what it seems like for them. So back in early 2020, I ran across a couple of companies across the country that were doing these clinician house calls. And I thought, oh, that's pretty cool. I really like that. I really kind of like that. That brings the healthcare to the patient right off the bat. That should be better. Okay. So I recruited a friend of mine, Pete Johnson, who is a tech entrepreneur. He's started, run, scaled multiple tech companies. And so he and I started to dig into this. And what we saw that, there are these other companies that are doing these house calls, but most of them are not really leveraging tech in smart ways. They're basically recreating traditional healthcare organizations with the big billing teams and the big reception teams and all this kind of stuff. And, if you try to use their app, it's not a true app. It's just like a web form kind of thing. And it doesn't seem like it's integrated with their electronic medical record. I mean, it like triggers them to call you. So we said, oh, okay, well, hey, we can leverage tech in a smarter way to really automate everything around the visit. Because the value in healthcare happens when the provider is with the patient, right? That's when the value happens. Everything else is a drain. Everything else is a leech. And so we've automated the scheduling, the triage, the payments, the charting, coding, all these things we've automated so that the provider can very cost effectively go to you at a time that you pick. And so we started the company in late 2020. We started seeing patients in the Madison, Wisconsin area, spring of 2021. And it was like a friends and family kind of thing, just kind of letting people know. Before that, we actually recruited a chief medical officer, Dr. Andrew Culp. So he actually started the company with us. And he's a very entrepreneurial clinician. And so, like I said, we would let people know, hey, we're just kind of doing this. We were starting to get our contracts with insurance companies. And so, over time, now we're in network with all major payers. Okay. And so then fall of 2021, it really started to take off. And then we opened up a second metro office in the Milwaukee area, have kept on growing. And then in August, we opened up in La Crosse, Wisconsin. So now we're seeing patients in 3 metro areas. Like I said, we're in network with all major payers. We've got full-time providers out there seeing patients. We have a very small back office because, like I said, we're automating almost everything. And people love it.
Yeah, I completely understand why they love it. I'm in St. Louis, so I cannot use your services yet. I
Yes,
hope you
yes.
come south soon. So I have
Yep.
3 young boys, and I can only imagine the ease and amazingness of having somebody come to my home for them whenever illness strikes. So let's talk about your app a little bit more, because I think we've worked with really large hospital systems in the process of watching them try to integrate their existing systems into an app is always a huge headache. And they always say at some point during the process, oh, I wish we could just throw everything away and start over from scratch. And you had the beautiful ability to actually start from scratch with no preconceived notions about what it had to look like. So talk to me a little bit about that process. And then also from the patient's perspective, the ease of scheduling an appointment.
Sure. So, I mean, you're right. I mean, when you have these huge legacy systems and processes, it is incredibly difficult to try to build new solutions around those. You know, right? And I ran a healthcare IT company before this, so I mean, I've seen it firsthand. So with this opportunity, we were able to really look for best of breed tools, you know, the best tools out there that would serve this um, mission, right? And so we chose the Athena electronic medical record. Okay, that's our back end. And the reason why that we picked that was because it had the most robust APIs out there,
Nice.
okay, by far. So we knew that we can build our own mobile app and do other things that would fully integrate with that. So we saved a tremendous amount of cost too, because we didn't have to have like a big database. We didn't have to implement Oracle or you know, SQL Server or Snowflake or anything, because we're using the electronic medical record as the backend. Okay, and then you know, the cost to develop apps has come down tremendously. I mean, you know, years ago, what we did would have cost millions, right? We did this for a couple 100,000. I mean, it was really very low.
That's amazing. That
Okay.
is amazing.
And, you know, with my background, with Pete's background, we were able to really kind of, again, best practices, what is the best design, kind of, you know, get a really good specification and, you know, build the app so that, again, it's super, super easy.
I love it. That's so smart. So you have this app, you have the entire system set up ready to serve patients. What was your go-to-market strategy? How did you actually raise awareness within the patient populations of the metro areas?
Yeah, I mean, it was a lot of social media, just trying to get the, you know, get the word out there. You know, this is not a solution that's for everyone. There are a lot of people that really like going to the doctor and they like to sit in the waiting room. I don't know why, but there are people that actually like that. And so, you know, there are populations that this is perfect for, who immediately see the value, right? And that tends to skew a little bit younger, right? You know, people are so used to ordering food with their phone, to ordering mattresses with their phone, right? I mean, years ago, to buy a mattress, you had to go to the store, you go and you lay down on the mattress, and oh yeah, I think this is okay, and then you would like buy it. Now, you just go to Casper or to whatever, and you just place the order, and the thing shows up at your door, right?
Mm-hmm.
People are used to that, and during COVID, that accelerated, right, even more. So, you know, it's reaching those target populations, getting the word out there, like I said, via social media. We do some Google AdWords. We've started to reach out to employers that have the health plans that we're contracted with. And that's been really successful because it's not a sale. I'm not going to them with some new digital health tool. It's like, oh, we're going to save you money, right? I mean, everyone says that, right? It's like, no, this is in network. This is super convenient, and people immediately see the value. Actually, the most common response that I get is, oh, I don't believe you. I don't believe that you guys are doing this. No, I'm like, no. I'm serious, really. You pick the time. You tell us how. We show up at your house. Oh, and by the way, it costs the same or less. People are like, no, I don't know. Come on. I'm like, yeah, no, I'm serious. So that's the biggest challenge that we have, is to convince people that we're not full of it. Like this is real. We're actually doing this today.
Yeah. I mean, it makes sense. I mean, all of the traditional hospital systems, there's so much bureaucracy. The thought of somebody being able to just start from scratch and make it this easy does seem crazy. So it sounds like as you're walking through your target audience, it sounds like you've done a lot of persona development work of really understanding who the perfect buyer is, what their pain points are. I mean, did you go through a formal process of defining that, or is it something that you just kind of knew from the beginning and have kind of followed that path?
Yeah, I mean, we knew from the beginning because we are the perfect customer, right? We're all busy professionals. I mean, so I want something we built something that I want to use. And this is common sense. I mean, this is, people want to save time, right? People want to get things on their schedule. There's processes, that Amazon or these other companies have already created that we're, copying. I mean, they're, you know, buying things from your app, as people have been doing that for years. It's gotten better and better over time, but we're just bringing those things into healthcare. Healthcare still uses faxes, right? I laugh whenever I hear someone say fax. I'm like, I can't believe we're still using. I don't
Why?
understand
Yeah.
why. Right? I mean, but we're
Yeah.
still. That's how healthcare is, right? It's
Yep.
so far behind. And then also, what I've seen too is a lot of traditional healthcare organizations, they look at these rules and they kind of take it to the extreme, right? Like they're like, well, you can't use text message. I said, well, wait, why? I said, yes, you can. Sure, you can. If the patient consents to it, you can definitely text message. Now, we're not going to text you a sensitive test result, right? We're not going to do that.
Totally.
But patients want to communicate in that way, and as long as they consent to it, all that kind of stuff, and it's totally fine. I mean, if you consent to it, I can take your test results, I could put them on a billboard. Okay.
Absolutely.
If you consent to it.
It's all about
right?
consent, for sure.
Exactly. Right. That's how it is. Right. And so I've seen bigger organizations are like, oh, we can't use SMS text. I'm like,
very risk averse. Absolutely.
Yes, exactly.
Everybody's so afraid about HIPAA compliance that they just choose not to engage at all with smart technology.
Right. And you just have to do it smart. You have to, but that's what patients want. That's how they're communicating with their friends. That's how, I mean, that when I'm talking with my kids, it's through text message, right? That's what it is, right? I mean, and that's what people want. And so that's what we're doing. It's just kind of bringing it to what people want.
I love it. So where should we expect to see you in the next 5 years? What do we think? What's going to happen with Pivotal Health?
We're growing. We're looking to expand to more metro areas. We're trying to figure out what are the next metro areas. Having started in Wisconsin, it makes logical sense for us to expand to other states in the middle of the country, but we'll see. We're as entrepreneurs, we are very opportunistic, right? So maybe we'll pop up in Charlotte or in Atlanta. I can't say for
St.
sure.
St. Louis?
Maybe we're definitely looking at it. It's on our short list, right? And I mean, what we know is that people love this, right? And so there really is no place in the country that we can't go to.
Yeah,
there is no place. I mean, so it's just a question of us trying to use our resources as smartly as we can to figure out what makes the most sense for us.
Absolutely. Well, Sal, I wish you nothing but the best. I'm so excited to watch your trajectory over the next couple of years. Thank you for being on. For all listeners, I'm going to put not only a link to Sal's LinkedIn link, or profile in the notes, but also a link to their website. So if you want to learn more about Pivotal Health, you can dig in. So thanks for tuning in, folks. Look forward to seeing you on the next episode.